One of the things that I speak about all the time is the sole obsession that surgeons have with one metric. And the one metric that everyone worries about is failure, that you're going to re-tear your ACL if you know, and that's the problem because the early BEAR trials had a slightly higher rate. We just talked about some of the reasons why that was and how that's going to come down with time as we get better and better at it. But the one thing that nobody talks about is the morbidity, the word we talked about before, of the surgery. When you repair the ligament, the surgery is dramatically less morbid to the patient. So the recovery is easier. The muscle doesn't get as weak. We don't take a graft. We don't drill tunnels. So there's all sorts of benefits to not doing a reconstruction. Doing a reconstruction, the word I use for my patients, it's kind of like making a Frankenstein ligament. And many of my patients, I've heard over the years, I've done over 700 repairs. And I listen to my patients very carefully, and they tell me that the reconstructed knees, they feel stable, but they just don't feel right. And the patients who've had repairs or repairs with BEAR, they tell me that the knee feels pretty normal, that they don't really think about it that much. Now that's one tremendous benefit, right? Because you're keeping the anatomy, you're keeping the nerve endings, the blood supply, you're not drilling tunnels, taking grafts. So it really is the closest thing you're ever going to get to not having torn your ACL, which is all you can really ask for, right? But on the other side, there's also the downside risk of arthritis with the reconstructions. Most studies out there show that people after reconstruction have a 10 to 40% chance of showing X-ray evidence of arthritis within 10 to 15 years after surgery. Now that doesn't matter if you're doing on an old codger like me, right? But if you're going to do the surgery on a 15-year-old, that means by the time they're 30, they're already showing signs of arthritis. And that's really distressing. That really keeps me up at night.